First part, clinical communication criteria. It consists of 4 components: relationship building, understanding and incorporating the patient's perspective, information gathering, providing structure, information giving. Coming to the first part, relationship building. Introduce yourself politely. Hi, my name is Dr. Aiza. May I ask your name, please? And be kind and respectful. You may choose appropriate words. For example, would you mind if I check your blood pressure? Or be empathic. Say, it's important for you to consider quitting smoking. And also, you may advise in a firmer tone. Coming to the understanding and incorporating the patient's perspective, you may remember this by the mnemonic concern, sense, the worry. How the concern, sense, the worry is first, you may attract their concerns. For example, what brings you here today? You may ask, and then you must sense something that you might be sensing the nervousness, sadness in your patient. You may ask, I sense your nervousness about the procedure. Or if you are discussing something, you can also judge the worry. For example, you may say that you just mentioned your worry about the procedure step you are discussing so far. Or now, coming to the information gathering component, you must gather all the relevant informations. For example, when you ask about her concerns, her worries, and her nervousness or sadness about certain things, you may not be sitting quiet and listening to the patient, just making your faces. Just you also be echoic. For example, you may produce sounds, oh yes, good. And then do open to close-ended questions, never close to open-ended questions, and make yourself clearer. For example, your patient might be saying that I just went through this procedure, and while on the operation table, I was feeling funny. So just clear yourself. Would you mind if you tell me meaning funny? And then providing structure component, give a logical sequence to the patient. For example, if your patient has severe preeclampsia, and you will first mention her diagnosis, and then you can logically, in a logical sequence way, you can say that now we will proceed to the medication part, and we will attach a drip to your arm and give you medicine, and then you may explain the procedure of emergency cesarean section if there is suspicion of intrauterine death. Then start signposting. For example, you can say, now that we have talked about the reasons of your asthma, let me show you how to use inhaler. Or also deliberately pause after a certain information in order the patient to absorb your advices or your concerns. And then use certain linking phrases. For example, you might say, first, we have talked about the diagnosis. Now I'm going to the medication part, and then explain the procedures. Use these linking phrases. For example, first, then, and etc. And last part is the information giving part. Always ask or judge the knowledge of your patient, what he or she knows about herself, about her disease, and what are her positive and negative concerns. Then chunk the information into a manageable amount so that your patient can absorb. And in the end, you may ask your patient that if she has any queries or she might have any question.